Science and the Institute of Political Economy of Carleton University. Her specific research interests focus on citizenship and migration, gender and politics, regional integration, and globalization. She previously taught at York University, Toronto, and Trent University, Peterborough. She's also held a Killam postdoctoral fellowship at the University of Alberta in 1989. And the second presenter will be Mona Osman. She's a researcher and impact analyst, Equity Ottawa, and works with the Ottawa Local Immigration Partnership. Mona is a research methodologist specialized in equity, inclusion, anti-racist approaches, and broadly social and cross-cultural psychology. She holds a PhD in psychology from the University of Ottawa and has published in psychology journals on ethnocultural diversity, mental health, and youth civic engagement, with extensive theoretical and research experience in qualitative and quantitative methodology. She's passionate about the value of data and research in understanding and improving the lives of immigrants and racialized communities in Ottawa. So please go on, Christina and Mona. You have both 15 to 20 minutes, or together about 40 minutes.
So thank you. I'm going to start, and by way of starting, I will direct your attention to this piece of art called Art as Resilience, and it was produced by elementary school kids, and it was on display in Kew Gardens in London, where I took this photo when we could still travel. I've used it today because the concept of resilience grounds the paper that Mona and I are going to present to you. I should say the genesis of this particular paper was based on sort of my initial observations of the health sector table in action at OLIP. And OLIP is a partner with us in building migration resilience in cities. So we're involved with them with two other projects. But this project really does stem from some of my initial observations and thinking about the role of OLIP during COVID. So I think the concept of resilience is particularly useful to understand how people cope with adverse events. And I think we can agree that COVID-19 would fall under that description. Shall we go to the next slide, Mona? Am I doing? Yeah. Okay. So the COVID pandemic was initially characterized as the great equalizer, with public figures such as, the New York mayor and Madonna emphasizing that anybody could contract the virus. And that rhetoric has certainly been challenged by reality, as it became evident that the pandemic does not affect everyone in the same way. And in Canada and elsewhere, the inequalities that characterize our society became much more apparent, with those on the margins. And by that, we can think of groups such as poor, migrants, women, racialized minorities who were disproportionately affected. So it's somewhat commonplace, I would suggest, to assert that policy responses need to be attuned to differential impacts if they don't want to entrench existing vulnerabilities. But how exactly does that happen, right? And within this context, we would suggest that a local organization has the potential to bring concerns of those who are positioned at the margins to the fore and shape policy responses. And this very paper. So in the paper itself, we look at concepts of social resilience and the institutional context. We highlight some aspects of Canada's economic response plan, and this is not like a huge sort of evaluation, but just some highlights. And we considered the activities of OLIP. So what I'm going to do is make some brief comments about those first two bullet points, and then Mona will present some of the activities that OLIP has been engaged in. So next slide. So in the paper, we draw on this particular definition of social resilience. And I think it's important because of the emphasis it draws our attention to, that is the role of the state and other social institutions in fostering resilience, and its recognition of the inequalities that shape migrants' participation and by extension, their ability to navigate the pandemic. So as I said, in the paper, we look at the federal government's efforts in terms of the economic recovery plan at the national scale and the role of a local institution, OLIP, at the local scale. So as many of you might know, local immigration partnerships are somewhat unique to Canada's model of settlement. They bring together not just organizations serving migrants and refugees, but also school boards and health units. And they speak to a broader governance of migration at the city level. And I think that's important. Next slide. So we examine the government's response to the pandemic by highlighting the supports provided to individuals across the country. In March 2020, the federal government introduced the COVID-19 Economic Response Plan. These were programs designed to support individuals and sectors affected by the pandemic. And these were rolled out fairly quickly. And I've highlighted some of the key supports here: the emergency response benefit, the emergency wage subsidy, and the emergency student benefit. So if we take a closer look at the emergency response benefit, we can sort of draw out draw a picture, let's say. So if you go to the next slide, Muna, I think it is. Yeah, so in terms of the recipients and applicants, so of the workers who receive payments, women receive payments more often than men. Visible minorities receive, 41.4% of visible minorities received CERB as compared to 32% of the population who did not belong to this group designated visible minority. And of all immigrant workers admitted to Canada from 1980 to 2019, 41.2% received CERB in the first months of the pandemic. And these figures are important because they underscore how CERB was a resource for many people, but they're also telling insofar as they speak to different forms of precarity. Next slide. So this said, though, and without diminishing the importance of that resource or support, many migrants, including temporary workers and international students, still fell between the cracks. So the World Economic News, for example, conducted a survey of permanent residents, temporary foreign workers, and international students. It was surveyed more than 4,900 people. And, some of its figures are particularly telling. It's 14% lost their job due to COVID, 48% reported receiving some benefit, but many were not aware they could qualify for CERB, for instance. And only 19% of permanent residents contacted a social agency for help. In the last section of the paper, we move on to looking at the situation of Ottawa and OLIP's activities during the pandemic. And on a national scale, the role of the federal government through the Economic Response Plan was a critical resource, but at the more local scale, we want to suggest groups such as OLIP play a really important role. And the last section of our paper maps that role. So in Ottawa, next slide, Muna, the full impact of the health crisis on newcomers and racialized populations remains to be seen, but data from Ottawa Public Health conducted in the first stage of the pandemic is particularly revealing. So what it showed was that racialized populations, especially those who identify as Black, are overrepresented among the people diagnosed with COVID-19 in Ottawa. In most racial groups, females are more likely to be diagnosed with COVID-19 than males. Among the people diagnosed, most of those who are racialized are immigrants, that is not born in Canada. And people who identify as Middle Eastern, Black, and South Asian appear to be among the more recent immigrants. Further, people working in health-related occupations have been the most affected by COVID-19, and people who are racialized are overrepresented across all occupational categories. So migrants and racialized groups are more exposed to risks and impacts of COVID-19 due to multiple factors, including their life conditions, employment housing conditions, the reliance on public transport, and perhaps inequities in access to health care. So I'll turn it over to Muna.
Perfect. Thank you, Christina. Okay, so I guess given that context and all that the different federal government structures that was put in to really support and respond to the needs of the pandemic, I'll speak a little bit about the local sort of level, how OLIP played a role, what our LIP was doing during that time, and just outline a few of the activities and sort of the strategic priorities that we set with the partners that we were working with. So just to briefly create a bit of a context, once, early in 2020, OLIP as the LIP in Ottawa was really well positioned among in the city to really bring different perspectives and partners together. So just to speak a little bit about the pre-pandemic enablers, we had at a provincial level public health standards that emphasized health equity and had outlined I guess maybe not data collection quite at that point, but at least ways in which inequities in health can be captured. We also saw at a municipal level, the City of Ottawa had launched their anti-racism strategy and plans. And then within the immediate partnership, we had a shared vision and priorities that was set across 5 sector tables. So really spanning the entire sort of spectrum of public institutions. We also had the equity partnership. So this is sort of a subgroup of OLIP partners who really worked over the last 8 years to prioritize equity, to have a shared understanding of the key concerns, and really have tough conversations about the reality of racism and inequity in our city. And then within the last about 5 years, OLIP has been really working to build capacity across all partners to collect disaggregated data and to use that data to plan and to help and to improve accountability across public systems. So once, given this governance structure, given how OLIP sort of functions, it really created a platform for collaborative planning. We saw early on, OLIP sort of switched into an emergency response mode where several of the sector tables sort of culminated into a health and well-being table. And this table, rather than meeting every 3 months, met monthly and had reports shared by health and well-being partners on the progress that was being made on their different initiatives. And then also at the same time, OLIP was part of a smaller leadership group that met several times a week to discuss the disproportionate impact of the pandemic on immigrants. And this was happening right, February, March, early into 2020. And then out of those conversations, OLIP sort of launched this strengthening disaggregated data related to COVID initiative. And part of this initiative was really to bring together 3 strategic priorities. It had partnership as being a key element, recognizing that the complexity of the disproportionate impact was not going to be addressed by any one partner, but rather that collaborative work is really what was needed. There was also an element of data. Without both qualitative and quantitative data to understand the disproportionate impact, it really would have been difficult to try to figure out what was happening and to identify how to best address it. And then another key strategic priority was community engagement. And this effort really grounded both the knowledge and expertise that community members had around how COVID was impacting their families, their livelihood, their health, their mental health, and really using that and harnessing that intelligence to plan and to create an equitable response. So part of this, it's within this context, it really, OLIP sort of galvanized implementing a series of different strategies. And one of the key outcomes of this disaggregated data initiative for the related to COVID was a community dialogue. So just to create a bit of a picture, OLIP was involved in meeting with OPH fairly early on in the pandemic, and there was a strong emphasis on collecting disaggregated data because it was clear and everyone sort of knew that there would be a disproportionate impact. It was just how do you get the numbers to show and to really gather that the force behind it and to put resources to addressing this impact. And then, so, you know, we were really happy to note that our local public health unit started collecting disaggregated data before provincial standards to collect it. That happened. So this was like a good month before the province mandated the collection of disaggregated data. Ottawa Public Health was already on it. And then by August had published a report outlining really what is the disproportionate impact, looking at the numbers, looking at race, looking at immigration status, looking at income, really being able to disaggregate exactly what was the disproportionate impact that many community members were really, you know, speaking about and highlighting. And then as a result of that in October, OLIP convened community partners, really brought all that energy together to identify community insights and figure out exactly what the issues were from as identified from the community and where can partners. And we had leaders from our sector partners at this meeting to really draw from that intelligence and then to respond in a way that best met the needs that community members had identified. So from this are things that have already sort of been mentioned, but we talked about precarious employment, transportation being an issue, housing conditions, access to information, food security, you know, the digital divide, low income, and the mental health challenges. So just to touch on, I think this is probably my last slide. So just to speak a little bit about, you know, how did OLIP then, given its governance structure, given the priorities set by the immediate disaggregated data initiative, what was, you know, what unfolded over, you know, a span of probably about 18 months. And really here you see a collaborative pandemic response that spanned multiple neighborhoods across the city. So there was 11 areas of need that were identified, and the health and well-being sector table put together a call to action around these 11 areas. And this was areas where, given that that meeting table now had multiple sector partners from education, from economic, as well as the health and well-being partners and city and municipal representatives, it was really a collaborative understanding around what the issues were. As a response to this, there was targeted protection. So you have the disproportionate impact, you have the community insights that's being aggregated, and then the partners developed education programs that were tailored by language. There was wraparound cares as a response to testing clinics. So you have localized clinics in neighborhoods, and then the wraparound cares that respond to those who have, you know, who experience various challenges. Then you have the voluntary isolation, and then as a response to that, there is the targeted vaccines. So really, as the actions are being taken, it's being focused. There's metrics being collected to see the effectiveness of some of this work. And then the last bit really is that we started to gather and to build with our partners grounded knowledge, understanding, you know, we have the community dialogue. We developed a report that's just about published on COVID stories, where we share stories of immigrant accounts of the pandemic. Research was commissioned. I think just through the pandemic response, we probably had about 4 or 5 academic partnerships that focused specifically on the impact of COVID on immigrants. We had the COVID data, and this required going back to community and asking for feedback in terms of, this is what the disproportionate impact is. Can you help us develop a narrative that is equitable to your experience and that best reflects those challenges? So really, it raised the consciousness and our awareness of the exposure that immigrants were facing, and the intervention then was planned to best respond to that. I think that's it on my end. I think, Christine, I'll probably pass it back to you.
Okay, so just briefly then, when we think about policy responses, I think that the activities of OLIP, as Muna outlined, can be seen as sort of promoting equitable resilience in policy. So in one sense, you can think about this strategically, like through their efforts, and most immediately, like improving access to welfare or to healthcare